Awesome. All right. So, since the beginning is a bit of an introduction and just to ground today's webinar, we can get started. We have three incredible panelists here with us today. And so, lots of great questions, lots of great discussion. So, we'll kick off with our introduction and then get into it. So, welcome everyone, and thank you for taking the time to join us today for our fourth webinar in the implementation community. And today's webinar is titled Intersectionality and Implementation Science in Child and Youth Health, Development, and Disability. And you can see our panelists' names on the slide there. We have Karys, Logan, and Cole. And we're very grateful for you to be here today and share your knowledge, your wisdom, and experiences with us. And just to highlight that today's webinar, just like our September one, is co-hosted with the CHILD-BRIGHT Network. So we're very excited for that collaboration and that partnership in this webinar and webinars to continue forward. So prior to getting started, we want to take a moment to give gratitude and acknowledge the land in which we have the privilege to work, to grow, to connect, and do the things that we do each and every day. As KBHN and CHILD-BRIGHT are national in scope and reach, we give gratitude to the many lands and acknowledge the traditional territories our networks work and operate on. So we encourage people to take a moment to reflect, to share where you're joining, your locationality in the chat if you are comfortable. I myself, my primary affiliation is McMaster University CanChild, which is located on the traditional territories of the Mississauga and Haudenosaunee Nations, Treaty 3 territory, and protected under the Dish with One Spoon Wampum Agreement. In this image here, while our weather does not look like this quite yet, although we did have some early snow here in Ontario, thinking about the changes in the season and different ways in which we can connect to the land. And I also encourage us to always reflect on our own work, especially within the healthcare field or the different sectors that you're joining us from, and thinking about how your work connects to the 94 calls to action, and always thinking and reflecting back on that and being intentional. So a little bit about our implementation community. There are two main kind of components of it. One being our webinar sessions, just like today. And then another one is our community or group chats, which are specific to KBHN project teams and implementation support related activities connected to KBHN. And really the community has four kind of key and interconnected goals. One is to build capacity and support in our community in implementation science and practice. So specifically within our community chats, we have opportunity for problem solving, sharing resources, celebrating wins, and then also bringing together and discussing different topics in the field of implementation science and practice through webinar sessions like today, that are highlighted from our community members, but also that, we're seeing and noticing in the field in terms of emerging topics, as well as bringing together the broader neurodevelopmental disability community and network to have the opportunity to share, to connect, and co-learn, and then advance implementation science in the field of neurodevelopmental disabilities. If you're curious in learning more about our implementation community, we encourage you to check out the website. So the QR code is highlighted there, and we can put the link in the chat afterwards. Here you can learn more about what's included, what's involved, watch past webinars, and we also now have a new resource section with resources that have been compiled and shared amongst our community and our expert presenters over the past year. All right, so I'll pass it over to Corey.
Well, thank you so much, Vanessa, and thank you for all you do. Thank you also to everybody who's joining us today on National Children's Day. It's an important day across Canada, but especially for those that we're working to serve. KBH Plus, as we're calling ourselves now, because we're not only the network where we leverage all of the incredible power of the public funds that KBH receives to try to put those back to service for the researchers, the clinicians and the families and ultimately the children and youth that we serve, but also really excited about our foundation doing the work that it can to help advance work across the neurodevelopmental health space. And of course, our newly launched innovation fund, the mechanism to mobilize private capital to further advance solutions, and really focusing on how to be sustainable through that market lens. Across all of these three organizations that come together as one, we really are focused on how can we do better for the children that we serve. And we're here to do just that through things like today. And I'm so, again, incredibly privileged to be able to join you folks and listen to some of the incredible thoughts that are being shared by our panelists today. I'll also share, just for those that are on this call, that KBHN is really committed to implementation as a pathway to help further improve outcomes for children and youth. For those who aren't aware, we are currently posting a call for our implementation level 1 certification. It's an open call on our implementation webpage. For those of you who might be interested in furthering advancing your own implementation careers, please apply. We're really excited to be able to make these investments into our ecosystems to further advance outcomes for kids. So thank you all very much for your attendance today. It speaks volumes, and I'll pass it over to our incredible partners over at CHILD-BRIGHT.
Great. Well, thanks everyone for joining, for having us today. I'm Celia, and I'm representing CHILD-BRIGHT as the co-lead for the training and capacity building program. And for those of you that don't know, so next slide. CHILD-BRIGHT is a national network as well, focused on children and youth with brain-based developmental disabilities, and we really focus on that patient-oriented research aspects of our work. So we have members from across the country and are very pleased to be co-hosting these sessions with that focus on that implementation and having that impact for the people that we work with. And I think, so just to highlight that our mission is that we do work very closely with youth and partners to really foster and a brighter future for children and youth with brain-based developmental disabilities and their families, and really looking forward to continuing to co-host these sessions on topics that we think are really relevant across both of our networks. So always open to your suggestions on some of those topics as we continue to move this forward. Well, thank you.
All right. So thank you so much. So just to highlight a few things for our webinar, you will be unmuted primarily, but if you would like to unmute yourself or request to be unmuted during our questions and discussion period with our panelists, please raise your hand and I can do that for you, as well as we also have the chat function and Q&A functions enabled in this webinar session. So you can also ask questions through that or share your reflections in the chat. So the objectives of today's webinar are the following. First is to explore the concept of intersectionality and why it is critical to consider in implementation science, particularly in the field of child and youth health, development, and disability. To learn from implementation projects that have successfully embedded equity, diversity, and inclusion principles and intersectionality with a focus on child and youth disability. And thirdly, to discuss strategies and ethical considerations for designing inclusive and accessible implementation projects that center intersectionality. All right, so prior to getting started, we're just going to launch 2 poll questions, and then I'll pass it over to our panelists to introduce themselves. So we are, inclusivity is one of the core values of Kids Brain Health Network, and we humbly acknowledge that we are on a journey to learn and do better and reflect on how to embody inclusivity in our activities. So we want to better understand and equitably engage our members and broader community who attend these webinars. Additionally, we want to get a sense of differing knowledge and experiences related to the topics that we're presenting on. So I'm going to ask 2 poll questions now, and then we'll ask one again towards the end of today's presentation. So you should see the 2 questions there. And please answer to the best of your abilities and whatever you're comfortable with. All right. Most of you have participated. I'll give it another few seconds here. And I'm seeing, I won't share the poll results with everybody, but I can just share a little bit around the knowledge piece. We do have a bit of variability with some people being not at all knowledgeable about today's webinar topic, some people being somewhat knowledgeable, and then we do have some people identifying as being knowledgeable about today's topic. So that's great. So mostly in the somewhat knowledgeable to knowledgeable. All right, thank you, everyone. I'll end the poll there. Okay. All right. So now I'm going to pass it over to our panelists to introduce themselves. So we can just go by the order on the slide if you're okay with that. So we can start with you, Karys.
Thanks so much, Vanessa. So, as Vanessa said, my name is Karys Peterson-Katz. I'd like to start by introducing myself with my positionality. So, I am blonde, I have blue eyes, I'm wearing a black blazer. I'm a white, queer, Ashkenazi Jewish woman, and I am from an academic, primarily academic background. So, I have my Bachelor's of Arts and Science from McGill University in Cognitive Science with a minors in Social Studies of Medicine, and I have my doctorate in neuroscience from Queen's University. I am currently a data and evaluation specialist with infant and early mental health promotion at the Hospital for Sick Children, and I work on a couple of different projects. The one I'll be speaking about primarily today is the Infant and Early Mental Health Care Pathways Initiative. I was about to go into a little bit more detail, but I know I have some slides on it later, so I'll hold off on that now. I currently reside in Kingston, Ontario, which is the traditional lands of the Anishinaabe and Haudenosaunee peoples. Thank you so much for having me today.
Awesome. Thank you so much, Karys. Cole.
Hi, everyone. Thanks for joining us today. So my name is Cole. My pronouns are he, him. I am a queer and trans man stewarding some land on the traditional territory of the Anishinaabe people, and my professional affiliation is the Ottawa Hospital Research Institute, which is on the traditional unceded territory of the Algonquin and Anishinaabe people. I myself am a Métis person living in a rural community, come from working class background, first in my family to go to university, and in particular to go on to do a PhD. And when I'm not doing work on intersectionality and implementation science, you can find me hanging out with my goats, chickens, ducks, and geese.
I love that. Thanks, Cole. Logan.
Hi, my name is Logan and my pronouns are he, him. I am also a queer and trans man that comes from Toronto in the Dish with One Spoon Wampum territory. Um, my educational background is as a social worker, specifically in public and social policy. But right now I work at McMaster University as a research assistant within rehab sciences, and one of the projects I'll be talking about today is advancing equity in childhood disability research partnerships with often excluded children, youth, siblings, and caregivers, a grounded theory study. I won't say too much about that right now because I have slides. And aside from work, I spend a lot of time in nature with my dog, Benji. She's wonderful, and I'm happy to be here today. Thanks for having me.
Thanks, Logan. If Benji wants to come on camera, that would be very welcomed. All right, awesome. Well, what a incredible panel we have here today. So really looking forward to the discussion. And before getting into that and some of the key questions that we have, I will pass it over to Cole to introduce concepts of intersectionality and implementation science.
Perfect. Yeah, so I thought it might be helpful before we get into our panel discussion, just to have a few slides in case you're new to intersectionality, and just to kind of get everybody on the same page. Next slide. So intersectionality is something that comes out of the work of Black feminist activists and scholars, and the word itself was coined by Kimberly Crenshaw in 1989, really starting to think about and draw attention to the ways in which Black women's experiences could not be adequately understood by looking at just race alone or gender alone, but rather it is the intersection of the two that is relevant to kind of their lived experiences and outcomes. Next slide. So intersectionality, just kind of at a high level, talks about the interconnected nature of social categorizations within systems of power and privilege in different contexts and over time. So drawing attention to how our different social identities can overlap and intersect. And at the same time, we can experience both advantage and disadvantage. And this advantage and disadvantage and the distribution of it is shaped by our experiences within interconnected systems of power in broader society. Next slide. So you often see it conceptualized as a bit of a circle where you can think about like an individual's unique circumstances and lived experience in the center, and how this might unfold or change over their life course, and shaped by social identities and locations, forms of power and oppression, and social systems and structures. Next slide. And I think it's important also when we're talking about kind of what intersectionality broadly is, it's also important to think about what it is not. So it's not simply a checklist of identities or just adding some demographic variables to your stats model. It's not just talking about diversity or equity and inclusion. It's importantly not just a topic for like equity deserving groups or marginalized people only. So intersectionality is something that is relevant to everyone and affects individuals' lives regardless of kind of where you are located. And I also think about it as not something separate from implementation work. So it's not something to just be like added on or at the end, but rather I feel like it's something that is kind of integral to everything that we do, because it's an approach for understanding context, power, variation in processes and outcomes, and people's lived experiences. Next slide. So some of the things that intersectionality offers is a way to kind of ask questions and uncover barriers and enablers. And in particular, what I'll say are maybe more hidden barriers and enablers. So things we might not necessarily think of immediately, or might not be evident to us until we start to ask different folks about their experiences and ask our questions in different ways. It can help us to understand differences within groups, not just between groups. So kind of acknowledging that, different communities are not homogenous. There's a lot of diversity within certain social locations and not just between different groups. It can help make visible how structures influence access to services and trust in those services. It can help us design more relevant context-specific strategies, help us to strengthen equity, accountability, and relationships, and really just start to think through real-world complexities that influence people's opportunities and outcomes. Next slide. When I talk about intersectionality, and it's something that it offers, and something that I think is super important when we're doing any sort of research and implementation work, is this concept of reflexivity. And reflexivity is an ongoing practice of examining our own positions, privileges, and relationships to power, and how, because of like where we're located, we may have certain assumptions, and these assumptions are ways of doing things might shape the way we design, interpret, and implement projects. And it also requires us to think about whose voices, knowledges, and needs are centered or sidelined. So kind of like who's at the table and who's missing. Next slide. And so you can often kind of engage in some of these exercises. A real popular simple one is this wheel of power and privilege. Just thinking about kind of where different parts of who you are might locate you on the wheel, with like power being kind of more concentrated in the center, and sort of less power going as we move out towards the outer rims of the circle. Next slide. Yeah, and the other thing I think is important to just acknowledge is that sometimes this stuff like isn't easy to talk about, or might make you feel a little iffy, and that's totally okay, because I think intersectional work often means getting comfortable with being uncomfortable, because acknowledging powers and equities in our own roles within systems can feel a little icky, right? But that discomfort, I think, is a sign of learning. It's part of being accountable. And I think it's necessary for building trust and equity and implementation in an authentic and meaningful way. Next slide. So, and then the other thing, I guess, is that people often get nervous, I think, when we talk about some of this stuff, like, what if I say something wrong? What if I do something wrong? And that kind of thing. And just a friendly reminder that doing intersectional work doesn't mean you have to be perfect. It just means you have to be humble, willing to learn, and open to being wrong. Because we all make mistakes. I make mistakes. Everybody makes mistakes, especially as we continue to learn more, do more, language evolves, and all of that stuff. So I think what matters is how we listen to people, repair when we do make mistakes, and kind of adjust how we speak and act going forward. The thing is, when you try to do it perfectly, I know at least for me, it kind of is paralyzing, right? So it just makes us afraid, prevents us from taking action, and really just keeps us engaging deeply with communities and with ourselves. Next slide. And I think this is the last one that I'm just going to end with some food for thought, something that I've been thinking about a lot lately, and that is that intersectionality and implementation science often focus on what's wrong. So we often talk about barriers, disadvantage, what gets in the way, all these sort of not so nice things, which are super, super important to understand and address and work towards changing. But I also wonder sometimes, about at the same time, what would happen if we centered community strengths, gifts, and expertise, cultural practices that already support engagement, resilience, resistance, and care, and possibilities for trust, relevance, and connection. So all that is to say, just as we work towards kind of merging these fields to kind of take us from a perspective of not just thinking about fixing people, but rather fixing conditions, and that we start to work with communities rather than just at them.
Amazing. Thank you so much, Cole. That was an excellent introduction to intersectionality and thinking about the considerations of the implementation science. And I love your point around it's not something that it's external to it, but should be grounded, and all implementation work should be grounded in intersectionality considerations. And I love this slide and the strengths-based piece, and thinking about flipping that script a little bit and how we frame some of this work. That's brilliant. So thank you. Okay, so I'm going to stop sharing. I'll share and then stop sharing as we work through the questions. But here is the first question being posed to the panelists. So why do you think child and youth health and development, such as disability, are often underrepresented in intersectional implementation questions, frameworks, and approaches? And what are the consequences of this?
Yeah, I'm happy to start if that works for everybody.
Absolutely.
Yeah, so I think I'm going to be speaking from my lens through the Infinite Early Mental Health Care Pathways project, specifically for why working with, children, and, families who have children who have neurodevelopmental disabilities or developmental delay, why they might be underrepresented in these implementation questions or approaches. One thing we see a lot is siloed sectors and siloed disciplines where different groups that work with families and work with children that have disabilities, they aren't necessarily coordinating, they're not communicating. So they might have different questions or different missions or different approaches to how they're looking to work or collaborate or understand children and youth with disabilities and their families. And that goes hand in hand with the with funding structures as well. So different sectors are funded by different ministries, or some have private funding, some have more public, like government funding. And the lack of coordination or these siloed sectors, it discourages almost these cross-sector questions that look at intersecting identity and needs. Um, and I also think that when we're thinking about implementation frameworks, a lot of them have been developed for adults or looking at the adult population, specifically like the adult population with disabilities. And when we're thinking about using frameworks with children and families that have children with disabilities, it's not necessarily recommended to sort of retrofit adult frameworks to children because, as we know, children are a completely different population and children with disabilities are a completely different population as well. So, retrofitting an existing framework to a new population isn't going to be taking into account their specific needs or their specific priorities or the specific questions that they're looking to answer. Um, and when we think about the consequences of this, we're now possibly excluding these questions or excluding these populations and their priorities and their needs because we haven't developed the questions and the approaches with them at the center of it. I'll stop there and I'll pass it on to the other panelists, but I do have some other thoughts.
Yeah, similarly, I was going to talk about my experience within the Advancing Equity Project. Specifically, during recruitment, we noticed that the people that were the most interested in participating in our study were ones that we've seen over and over again in the same spaces. And those are the people that are comfortable speaking to their identities. And I th that was like the opposite of what we were trying to accomplish um through the through the study itself, and just kind of proves our point within within the study, within the research question, as why often excluded groups get underrepresented within research in general. And also, like, I think that these frameworks and these um, implementation questions and approaches, they don't necessarily they focus on one part, if that, of intersectionality, like of disability, for example. And I agree with Katz um about it being about adults with disabilities as well. But also, I don't think they don't really like get at the multiplicity of the intersectionality within a single person or a person that's representative within that community. And I think some more diversity in terms of the identities would support making these questions and frameworks more equitable.
Yeah, absolutely. Those are excellent reflections. And I'm going to see, yeah, Cole, you have some thoughts on it
Oh
too.
yeah. No, just to add, I think part of it is that we don't, I don't think we think of children necessarily as having these full complex social identities. I think we think of like children as like childhood is the identity or like the category, or like children are just like an extension of their parents or something. And people maybe we think they're still kind of growing into their identities. So often we can overlook the very real ways in which things like racism, ableism, gender norms, colonialism, etc., already shaped their lives. So it's like, these experiences like don't just like suddenly begin when you turn 18 or something, but it's like very real from the time you're born. And I think, it can shape. I think there's not a lot of attention to like the impacts of these different identities. Even if we look at what's going on right now in Alberta with the rights and protections for trans youth, it's like something that's like very real and that like people are experiencing, but it's something that it doesn't get as enough discussion. And then I think just talking about frameworks also is that like a lot of frameworks, including in implementation science, either just don't explicitly have things about identity and social context built into it, or focus or talk about identity as like single axis, or as just like um, one thing, like you can only be one thing without acknowledging sort of all of the sort of many things that we are. And the other thing that I think maybe a piece of it, just quickly, is that I think sometimes like disability is framed from like a medical sort of lens, and not necessarily as like a social identity, which like it very much is part of impacted by broader social systems. And so I think that's just something to consider. Like I think it's often seen as like something to like treat or fix or support or like whatever, but it's it is certainly shaped by ableism and social structures, and also, tied people's experiences of disability are certainly tied to also their experiences of like race, class, gender, etc. So, just yeah, something to add.
Wow, those are really excellent reflections. Um, yeah, it's okay. Before I kind of add some thoughts, I just wanted to pass it back to you, Karys. You said you had some additional things you wanted to add, or if anybody just wants to add any additional thoughts there.
Yeah, I think my two other panelists, they touched on a lot of things that I was also thinking. And another thing that comes to mind, as Cole was speaking about the complexities and the way we're looking at, multiple identities and multiple facets of identity as well, is it brings for, I'm speaking from the research lens, for many researchers, it brings in now a lot of ethical and logistical considerations. If they're working, let's say, with a research ethics board, there might be, more processes they need to go through. And for many people in academia, this might be something that they are looking to avoid rather than to adapt to or to build in. So that's something that I have seen come up, and it brings to mind, a study I read many, many years ago about how most, mouse models are in male mice because the researchers didn't want to adapt to the female hormone cycle. And so, we lose a whole aspect of understanding when we start to exclude what we need to understand, and we can't just adapt to one single lens of understanding and then imagine that that's going to fit everybody else because it just doesn't.
Brilliant. Wow. Yeah, that's I think an excellent starting point and great segue into our next questions. But I just wanted to point out the pieces that really stood out that each of you highlighted. I think, Cole, around your point around the assumptions that we make about like childhood being the identity versus the multiple identities and the experiences that children have, and how sometimes we don't account for that in our work, whether that's research, implementation, engagement. And then Logan, speaking to your point about, you keep hearing from the same people. And why is that in both research and implementation related activities? And again, really ensuring that we're being intentional about that and really questioning our approaches so that we can be more inclusive. And then, Karys, your points around the siloed nature of our sectors, and that a lot of work, is exclusion, like excludes particular groups of people. And thinking about the frameworks that we have, most of them have been developed in that adult space, and often only even then consider one or a few aspects of a person's identity and not the whole context, the whole picture. And then I love the points about, even disability as itself being a social identity and a construct imposed by our systems and structures. So this is excellent. I will move on to, before actually moving on to our next question, I did see there's a question in the panel. There's two questions actually, so maybe we can go to those quickly and then we can move on to our next panel question. So we have a question that says, thank you for presenting on this topic. My question for the panelists, how do you define equity deserving groups? Do you have any suggestions to draw on that exist in the literature or from an organization? Thank you.
I'm also happy to jump in with how I define equity deserving groups. Um, so for myself and through the lens that I work in, um, I refer to equity deserving groups as populations that have been historically disadvantaged and face systemic barriers to equal opportunities in education, employment, social settings, and other areas of life and society.
Thanks, Karys. Cole or Logan, if there's anything you wanted to add there. All right. Then we have another question. A large percentage of children and youth with fetal alcohol spectrum disorder have joined families through adoption, adding another layer of complexity, trauma, and issues of identity. Many experience transracial adoption. How do you see this relating to intersectionality for children and youth with neurodevelopmental disabilities? It's a big question. We could also take a moment and pause on that and come back to that if that's if you're the panelists need a moment to think about that. Yeah, take a pause and then we'll circle back to that. Okay. Thank you for that. That good. Both of those questions are very good. So we'll come back to that. All right. So I'm going to get to our next question now. Okay, can you see that okay? Fantastic. Okay. So we talked about some of the challenges, some of the gaps that we're seeing, starting very not strengths-based as the point of Cole's slide. But let's now think about some examples of successful implementation projects that you've been part of that have embedded equity, diversity, and inclusion principles and intersectionality. And in thinking more generally, and or in the child and youth disability contexts. And then also thinking particularly about what made these projects successful, and how were you able to incorporate those principles and practices. So we have some slides. So Karys and Logan, I know you have some slides about your particular projects. So would you like to go over those slides and then maybe speak to this question more broadly, or what would you prefer?
Sure, that sounds good.
Yeah, I agree.
Perfect. Okay.
So, as I said, I will be talking about the advancing equity in childhood disability research partnerships with often excluded children. And when we talk about often exclude children, let's think back to Karys's definition of equity determining groups, because I think that resonates with this project as well. But I do have some examples of who exactly we included. Next slide, please. So on this slide, it just demonstrates who we included and who we considered often excluded. Next slide, please. And so the study purpose was to address the lack of inclusive and representative engagement within childhood disability research generally, develop a theory, which is where the grounded theory comes in, because the end result of a grounded theory study is to develop a theory to explain the process of engaging disabled children, youth, and family members in research, and identify the constructs of engagement, the relationships between them, and explain how they function together and create positive and negative experiences of engagement for all parties involved. Next slide, please. So to address the research question, we adopted a qualitative approach and specifically a grounded theory design where at the end of our data collection and all the other stages of the research, we will be developing a theory based on our findings. So for the purpose of the study, young disabled children constitute as often excluded groups, but other participants like disabled youth and siblings and caregivers and researchers who work with them must belong to an often excluded group in order to participate. So we were looking at children and siblings from 8 to 12 and that either participated in research as participants or as research partners. All groups needed to be partners in research at some point. Next slide. Each of these main codes were comprised of several subcodes. And for the purpose of this presentation, I'll be focusing on one of our findings, which is engagement. Next slide. So to break down this code more, we came up with these principles of engagement, which include psychological safety, relationships and communication, meaningful and inclusive practices. Next slide. The first quote highlights psychological safety, and the second one highlights relationships. And these are from our participants within the study. I'll give you a couple minutes to read. Next slide, please. Again, the first quote highlights communication, and the second one highlights meaningful and inclusive practices. And I think that's where I'll end for today. Thank you.
Awesome. Thanks, Logan. I'm thinking about too, maybe we can circle back to some of those principles that you identified and thinking about how that can be applied and also the connection to different implementation projects and how people can think about it from that perspective. But yeah, I'll pause and then pass it to Karys.
It's Vanessa. So there's going to be a couple of bullet points on this slide, so you might just want to click through. I didn't realize this was one of the animated ones. Perfect. I think that's all of them. So as I mentioned at the beginning of this webinar, I'm working on an initiative, the System of Care Pathways for Infant and Early Mental Health. So what System of Care Pathways are predictable and equitable roadmaps to help families and practitioners navigate emotional well-being supports and services for children 0 to 6. So the idea is that we're trying to streamline what happens from the time a developmental concern is raised to how it is identified and how it is responded to through screening, referral, and follow-up. These are inclusively built within the communities, so built with the organizations, with the supervisors, with the practitioners to connect families to the care that they need in the most efficient way, while ensuring that we're taking into account the prevention, identification, and treatment principles of this work. This also enhances community capacity to recognize and respond to infant and early mental health and developmental concerns in the early years. So, trying to put in the prevention work as soon as possible to help outcomes become the best that they can, the most optimal outcomes for children. Next slide, please. So this is what the approach generally looks like. It is a bit flexible. We're always making sure that we're working with the capacity that the community has, but generally we follow these 5 phases. The first being community engagement. So with this work, we're not seeking out the communities and we're not looking for the communities that, I'm putting this quote, that need it, but communities that have heard of our project, that know of it through word of mouth, that have seen it on our website or come to a webinar like this or one of our conferences or one of our presentations. They hear about this and they reach out to us and say, how can we get involved and what are the next steps? And then we begin this community engagement piece, which is where we start having these meetings. We make sure that we meet with the community partners in a way that is accessible to them, whether that is virtual options or going in person, meeting, during the day, a half-day meeting, whatever works best for their capacity. And this is when we begin to identify who's already at the table, who's not at the table, why are they not at the table, and can we get them to the table if that's where they would like to be? So that's really what happens in that first phase is identifying who is here, who needs to be here, and what can we do to make that happen. We then move into service mapping and inventory assessment, which is really the identification of what's already happening in the community. So where do families go for their programming? Where are they going when they have concerns about their child? Where are they going if they are accessing supports and services? And then what happens? We also identify in this phase, how are the organizations speaking to each other? How are they communicating? How are they coordinating? And where are the silos and the gaps? This is also where we identify the strengths and the skills because we want to make sure we are also leveraging and building off of the capacity that's already existing within the community. Then there's these concurrent phases, phase 3 and 4, which is where we start to build what we call an aspirational pathway, which is where we have the conversations with our community partners and we say, what do you want to see in your community? What would you like to happen? And how would you like us to get there? So we begin building, like I said, an aspirational pathway where who should be involved? Who do you want to be involved? Who should be in what we call sort of the central screening hub, which is the identification of early developmental delays? Who's involved with that and how, in which ways, and when? And then who's involved in that follow-up piece? So that referral and where do families get referred? And also, what are the restrictions to referral? Is it that only Indigenous families can access these services, or only French-speaking families, or are these services only for families living in rural areas? So that we can identify the exact pathways for where families can go and how they can access these services. Are there options for self-referral, for example? And do families know that they can self-refer to these services? Then at the same time, we're doing ages and stages questionnaire and developmental support plan training with identified community practitioners. So the ASQ is a developmental screening tool that includes both physical domains as well as problem solving. And then there's a social emotional component that goes along with it. And then the developmental support plans are family-led strategies that can be incorporated into their daily routine. So we're really not trying to add anything onerous onto a family that makes them go to, let's say, to Toronto to sick kids to access the strategies and the services, but something that they can do within their routine, within their day-to-day lives that can support their child's development in certain aspects and certain areas. And then we get to phase 5, which is where the aspirational pathways are implemented. And this is when we disseminate the information. It goes throughout the community. And throughout each phase, we're also doing these iterative evaluation steps with families, with caregivers, with practitioners, with supervisors to see how is it working, who's it working for, and how can we improve it steadily throughout so that we make sure we're reaching who needs to be reached, who wants to be reached, and in the ways that they would like this information communicated to them. Next slide, please. So this is generally the mathematical breakdown of what a pathway includes. So who is involved in supporting the families? What are the steps to supporting the families? Where are these steps happening in the community? And what is the ultimate goal of this work, which is the timely and appropriate access to these supports and services for children from birth to 6? So these are some examples of what the practitioner aspirational pathways look like. So as you can see, they can look completely different depending on which organization and which communities we're working with. They can be for different age groups, they can be for different regions. So they're very much community-led, community developed within the systems that are already there. So we can see here on City of Hamilton, they had a couple of different pathways. So they had one for before school age, which was 0 to 3.8. And then they also had a school age map for 3.9 to 6, because there was that identification that the system looks really different once children enter school. It's not the same for how they access services. It's not the same for who's connecting with that child and with that family. And then if we see the other map for Center Hastings, so this was for Hastings Prince Edward County, and they had 5 maps because they recognized that their county is so large that there weren't systems that were just available throughout the county. Some were available in the east, some were available centrally, some were in the west, north, and south. So these were all broken down to ensure that each different region had a map that was accessible to their services and to the region in which they lived. Next slide, please. And then we also developed what we call family-friendly resources with parents, with grandparents, and with caregivers to identify how do you want to have this information disseminated to you, and what does this look like? Where do you want this information presented? So these were completely co-developed through multiple focus groups in each different community, some in different regions, some in different organizations, to identify what information do you want on this flyer? Do you want this presented as a flyer, number one, or would this be better as a pamphlet or a social media post? How do you actually want to see this information? Do you want a QR code? Do you want a phone number? So the titles of each of these ones, they're different in each community. The colors are different in each community. The photos that were selected are different in each community because they're really designed with the family's input and with their feedback throughout. Okay, and that's it for my project.
Awesome. Thank you, Karys. And Cole, I know you don't have a specific, there are slides for a specific project, but I just wanted to highlight, Karys, I love and I'm going to stop sharing actually so we can see each other. I love the focus on it being community driven and really leveraging things that are already happening in the community and the systems to really tailor it to the needs of what people are, telling you, their realities. And I think that's a beautiful example of thinking about how we can embed, differences in or EDI related principles and practices in some of our implementation work. And I think, taking that time to build relationships, listening, understanding the current context and realities is a great example of that. So I'll come back to our second question there. I won't start sharing again, but just coming back. So thinking about examples of implementation projects that you've been part of that have embedded EDI principles and really grounding in intersectionality considerations and concepts. So again, I think from both of those projects, you can see those examples. Logan, I think some of those principles you highlighted can absolutely be applied and leveraged to implementation and initiatives. And I do have a follow-up question, but I want to give Cole an opportunity to also speak to some of your work or any project examples that you'd like to highlight that really do center that intersectionality.
Sure. So I actually don't do work in child health, but I can give an example of projects, just a way to kind of maybe start thinking about intersectionality. And so one of the projects that I've worked on recently is working with communities such as gay, bisexual, and men who have sex with men who have historically been excluded from the blood and plasma donation system. And part of this work, what we looked for is not, or what we drew attention to is making sure that the community partners that we had involved in the project, and as we're designing interventions to support folks if they are interested in donating blood and plasma now that the eligibility criteria have been revised, to make sure that there was diversity within that group. So recognizing that like not all GBMSM folks are, one ethnicity or one age or one gender identity, etc. And then we looked at things like not just characteristics or outcomes like does this increase your desire to donate plasma a lot, but also looking into things from about kind of safety, trust, discrimination, accessibility, resources, different things about lived experiences that might shape how they engage with the blood and plasma donation system, and just really trying to ensure that we think about whose voices are here and whose voices might be missing, and also ensuring, and I think this applies for kind of a lot of intersectional work, not just using quantitative methods, but also qualitative methods. So kind of a mixed method or multi-method approach to try to get a sense of like, not only what outcomes we're observing, but the broader context in which those outcomes sit.
Amazing. Thank you, Cole. That's an excellent example. So appreciate you sharing that. And if there's any links also to any of your projects, feel free to put them in the chat and I can share them with attendees and registrants after. What you're saying and what I think also Logan said and Kara said around this, to do a lot of this work and to do this work in a meaningful and good way, there needs to be a sense of safety, trust. And Logan, I know one of the principles you mentioned was psychological safety. And it makes me think when you're doing these kinds of projects, what strategies do you employ to help build that trust, establish a perceived sense of safety, and then also thinking about that within the constraints of a lot of our project timelines, research timelines, and how can we ensure that we're not dismissing or we are still holding the EDI components central to our work. And yeah, I'll pause there. But I wanted to hear if you had any thoughts about that.
Sure. For example, in our project, the interview guide and anything regarding the recruitment stage or any stages for that matter within our study have been co-created by youth partners and also a child partner as well, um, who is um, who is turning 12, so she's actually quite young. Um, but I think, giving them an opportunity to to give their feedback based on how they've experienced a partnership in other teams and how they've experienced participating in research has really shaped our process into what it is and let it be as inclusive and accessible as possible.
I love that, Logan. Yeah, just having it led by the youth voices, the children's voices, families' voices, whomever it might be. Garris or Cole, any thoughts on that? And then we can get to a question in the chat.
Sure. Yeah. Just quickly, I think it's important to draw attention to the limitations of our current systems and structures around funding and how research is supposed to look and whatever. Just to call it out as something that needs to change. But I think, in part of trying to work within that system and also do this work in a meaningful way, it's important, even from like a grant writing perspective, to really build into as much as you can your process and budget, a plan for engaging in people in the project and supporting them throughout the project, to really make and to have people from the beginning, from the communities you want to work with, involved from the start. So not just like, okay, we put this together, can we review it? Can you review it and add it? But rather to develop it with them, and ask or find out about what would help to support them to be involved throughout the project. And I think also important to try to avoid tokenism, and I think it's, where possible, trying to involve a number of different voices, or at least like two people and not just one person, to make it kind of feel like, in terms of like a patient or a community partner, to make it kind of feel like safer and less like you're the only one in this room of researchers and doctors and whatever. And just, yeah, again, emphasizing the relationship piece, I think is key. And really taking the time to think about what that looks like and how to make that, and also how to sustain that, so it's not just like a one-off thing, but rather something that is a long-term and mutually beneficial commitment.
Yeah, I feel that my co-panelists have very well covered what I would say. I was thinking those relationship-based points, and it's hard, as you said, Vanessa, with the timelines for funding. As we know, building relationships takes time and it takes meaningful and intentional efforts. As Cole pointed out, it's not about, bringing them in just because like, oh, I need to check something off the box because I said I was going to do this, or, oh, we should bring them in now because we forgot. Like, it's really about having people from the beginning, and it's about genuinely wanting their input and caring about their input, because that's what makes it impactful. And that's how it's built for the people it's supposed to be built for. And it's for the communities that it's supposed to be for. I find there's really no one size fits all approach. You're working with complex people and you're working with complex communities and complex organizations. It's not something you can kind of just like slap one single framework on. You have to be adaptable. You have to be flexible. You have to be open to listening and to learning and to changing as you learn, so that you're able to work with people in the way that they want, they appreciate, they prefer, and they need. I also wanted to just really quickly circle back to the question about successful implementation projects, because it kind of ties into the question that Abraham put in the chat, which is, how do you apply intersectionality when measuring outcomes and evaluating the process? And my answer ties into both questions, which is why I wanted to highlight that. But really not over interpreting the outcomes from one single lens. So, for example, I began my introduction with my own positionality, and that's the lens in which I generally work through and I view, because that's the body I work in and the soul I work in. Um, so bringing in the perspectives of multiple different people and multiple different um, like levels. So not just working with supervisors, for example, because when I do the multiple focus groups that I do and the multiple meetings that we do with different people, the answers and the responses we'll get from supervisors on, for example, the same question will be far different from the perspectives of the frontline practitioners who are doing the work and who are actually putting it into practice and who are the change agents, which can then also be very different from the grandparents we're working with and the parents and the caregivers. And even when we're looking at the different sectors, if we're looking at the experience of an ECE versus a home visitor versus somebody who's working in child protection versus somebody who is working with the school board, everybody's going to have a different perspective on the same question. So one of the things we do, and it after we have these conversations and we have these focus groups, and the focus group questions are also co-developed with our partners to ensure we're asking questions that they're interested in learning about, that they want to know about. When we then look at all the information we've collected from these focus groups, we then bring it back to each partner, to the supervisors, to the practitioners, to the families, and we say, this is how I saw what you told me. Does this make sense? Is this how you're trying to does this reflect your experience? Is this what you were sharing with me? And did I understand this correctly? Is there anything you want us to add or change or remove? Is there anything that we can do to make this more fulsome to your experience with this work and with this implementation? So I'd say definitely, like, again, that collaboration piece is really important to make sure that you're not just putting one singular lens because it is very complex. It's not one layer, it's multi-layered.
Wow. Like mic drop after all of the things that you all have shared. That was brilliant. And I'm taking a bunch of notes here and glad this is recorded so we can revisit because I think a lot of this content as well is you need to constantly revisit it every time you read it or hear it. You think about it or I think about it from a different perspective or you learn more or you know more. So it can help with the reframing of some of this. And applying some of this. So this is excellent. And I just wanted to, so I know, so thanks, Karys, for answering and acknowledging Ibrahim's comment. And I see, Cole, you linked a paper there. Just wanted to give an opportunity if Logan or Cole also wanted to share anything to Ibrahim's question about how do you apply intersectionality when measuring outcomes and evaluating the process during the implementation of evidence-based interventions. I would appreciate any research experiences you could share.
Yeah, so I think importantly, when you're beginning, it's helpful to kind of clarify what your purpose is and who should be involved. It's not possible, to account for every single unique experience in a research project, but it is possible practically to think about, okay, like what communities might be most impacted by this issue I'm working on, or who might experience this differently, who isn't usually at the table but should be. So just kind of thinking through the sort of different communities that might be most relevant to consider, and then setting up data collection in a way that allows you to examine or to disaggregate, so to look at for differences within and between groups, and even just being comprehensive in the as much as you can be in the types of data you're collecting from a quantitative perspective. The Public Health Agency of Canada has sort of like a checklist for like quantitative research. I can link in the chat, but in terms of evaluation, I think really actually to do that intersectionally, it involves looking at indicators and outcomes that are community defined. So, not just the researcher being like, all right, this is important and what we should measure, but rather asking, people with lived and living experience, like what matters for you or what would be evidence of this working for you or what does success look like for you, and trying to also assess some of those things so that the whole the process is actually led by or defined by the people who it impacts the most.
Yeah, similarly, for our project within our own team, which will eventually lead to recommendations for the theory that we're developing. Um, we going back to what Cole said about reflexivity, um, we complete a reflexivity form as a team after every meeting with our youth and child partners as well. It just basically goes over like what are our strengths, what did we accomplish in this meeting, and what do we like about working together, what would we improve about our process, and through that, like I think that also speaks to how we can improve the research process based on our research question of how often excluded groups um, are being engaged in research. And I just find that process really helpful in terms of like personally as a young researcher, but um also I think it gives everybody a chance to like step back and see like this is bigger than what we're trying to accomplish here. This is about the people that it's going to impact, right?
Brilliant. Thank you. Thank you, everyone. And Logan, I don't know if that reflexivity guide or tool that your team uses, if that was team developed, if that was adapted from something already existing. But I'm sure attendees, if there's an opportunity to share what you've done, I think attendees would appreciate that. I know I would appreciate seeing that. I think some practical tools and resources like that are exactly what people are looking for to apply some of these more complex concepts and considerations into our research and implementation practice. Um, and Cole has shared some excellent resources. So I'll make sure that this is circulated to all the attendees and registrants after the fact. And I think this segues really nicely into our next panel question. And then, Nancy, I do want to circle back to your question and acknowledge that towards the end. So we will get to that. But our next question, and I'm not going to share screen again, but I can put it in the chat. Um, Thinking about tools and resources that can help us think about, and I think you already touched on some of these pieces and alluded to this, but tools and resources that can help us design implementation studies and projects to account for intersectionality. Are there any things that you know that exist in the field of child health and development? Um, Anything that you'd like to share or things that maybe you've developed? So, like Logan, the tool that you talked about, are there any other tools or resources that you can think of or that you have applied to your work?
Yes, our reflexivity guide was specifically developed for our team, but I can send you the questions to share with the audience. Um, and also I should say that this project that I'm talking about has now spun off of a separate project developing modules for research teams and how to engage children and youth that's kindly funded by CHILD-BRIGHT. Um, and I think some of the strategies that we use to specifically engage youth and children those within those modules are like, to gamify things and to, play things like Kahoot And like, for example, our child partner, like before we even get into the meeting, like the first thing she ever wants to do is play like a 10-minute Kahoot game. And that's how we start our meetings usually with her specifically. And like so in developing those modules for children and youth, we're really taking advice from the youth and the child that's on our team. And also there's a lot of imagination and creativity that comes out of that. Like for the child module, we're thinking about doing like a choose your own adventure module about like what is research and what is partnership, for example. And you can really see it coming together from like the perspective of a child or a youth. So I really enjoyed that.
Thanks, Logan. Those are great examples and great strategies. Sound like fun meetings. Karys and Cole, I saw you put something in the chat there. But yeah, if either of you would like to also share some other tools, resources.
Yeah, there's some frameworks that I know of, though I won't say that I've used these ones specifically, though I've heard of them. I've read a little bit about them. There's one called the Progress Plus, which is it's generally a checklist, but it is a tool to understand which aspects of identity are being included and in which ways they're being considered. So progress is spelling out like place of residence, race, occupation, gender, religion, education, socioeconomic status, social network, and capital. And then the plus is for age, disability, sexual orientation, and alternative groups as well. And then there's also the health equity implementation framework, which I believe was developed for research with HIV, but it integrates determinants of health equity into implementation work and planning. And it reminds me a little bit of the consolidated framework for implementation research, of which I'm much more familiar with. We use the CFR a lot in the work I do, which looks at the different levels of implementation. So, looking at implementation at the individual level, which also includes the identities of the individuals with whom we're working. And then it goes a little bit more broad. So it looks at the organizational level, we look at the community level, and then we look at the system level. So I would say I'm a pretty big fan of the CFR in terms of how it encompasses many different aspects of community work, implementation work, and lots of different domains and factors to consider. So those are the ones I'm familiar with.
Amazing. Thank you, Karys. And yeah, the health equity implementation framework is a good one. I haven't applied it, but I've read about it, and I'm eager to apply some of the concepts. And speaking about the CFR too, I see Cole is putting some work in the chat there, and I've also used your TDF article, Cole, and the questions that you pose around especially the social professional role and identity and how we can even tease that apart a little bit. So I love that article. But yeah, if you wanted to expand on some of those resources that you've shared there.
Uh, uh, just that they maybe are helpful starting points to try to think about from the beginning how to kind of like reframe your approach and incorporate some intersectional considerations, but also to say that like these are evolving things, right? So like even now, even with that TDF paper, for example, like I think there's a better way. There are better ways, So I think it's like these resources are all just like foundations of getting the kind of discussion started. And then one thing I did just share in the chat is this framework that was developed by some of our Maori colleagues, and really good example of kind of a truly co-developed implementation framework. And this is with this one in particular as Indigenous self-determination at its core, but would encourage folks to check that out as just even if it's not, relevant to what you are doing, it is the process that they undertook is a really good example of how to build in some of these different considerations and do it in partnership with community.
Beautiful. Yes. Thank you, Cole. And yes, so I'm going to compile all of these and I will share them with everyone after the fact, as well as our attendees or registrants who weren't able to attend today. So this is great. Yeah, I wanted to pause for a second. Celia, I don't know if you had any questions. I know we didn't answer Nancy's question, but I don't know if Nancy is still here. But perhaps it's something we could think about and answer, afterwards, or if you have any reflections on it. Awesome. Thanks, Celia. Yes, it is an excellent discussion. Another resource that, and Cole, to your point, I totally feel that. And like something is, it's essential, it's foundational. And then, a year, 6 months later, you're like, oh, we've learned this, or this should have been incorporated, or we could have done this differently. But I think that's part of the process. So I'm excited to see some of your other work and new work coming out. And same with Logan and Karys, seeing your work published and these shared in different ways, to have more examples that we can model from, right? I think that's always really helpful. So you don't have to reinvent the wheel and looking on and building off of the great work that people are doing already. So we can go then to kind of our final question before we wrap up. And this question is around ethical considerations. So thinking about what ethical considerations arise when implementing innovations with children and youth from intersectionally underrepresented communities, such as children and youth with disabilities. And, we can, if you wanted to share anything about that question, I'll put it in the chat. Or maybe just one or two key takeaways that you would like to leave attendees with as we wrap up the webinar. I was just looking at the time and that really flew by. What a great discussion. So very much appreciate your time. So I'll put the question in the chat if you'd like to address that or thinking about 1 to 2 key takeaways. And whoever would like to start.
I'm happy to start. One key takeaway, but also something I think that goes to the ethical considerations question is don't assume. Don't assume that you know what people want or you know what people need or you know what's going to benefit a specific population the best if you're not, a member of that particular population. I think that's goes back to why relationship building and true, meaningful, intentional collaboration is so important so that it really gets to the heart of impact. And sort of going back to something Cole had brought up about tokenism, really looking at the burden versus benefit balance. So looking at what we're asking of people and how it is going to benefit them, and also how we're compensating people for their time and energy and efforts and support. And again, really making sure that this is an intentional and meaningful work. And again, circling back to something that I had brought up, that implementation work and just research in general is not a one size fits all approach. It's not something you can just, slap a band-aid on or slap a specific framework on. Something that we learn through this work and, going back to Corey's plug for the implementation specialist course, which I took a couple years back, that adaptation, that flexibility, that willingness to learn, being comfortable with being uncomfortable, as the slides said at the beginning, um, sitting with that feeling and also doing that internal work on why are you feeling uncomfortable? Where is that stemming from? And how are you going to do the work of addressing it rather than expecting sort of other people to make that space for you to become comfortable in their space, working within yourself to grow and to learn and to adapt. Those are my takeaways.
Yeah, just really important point that Karys just made, and just to expand on it. Yeah, when you have people participating or in your and partnering in your work, to how to make that process accessible and ongoing to them. There are definitely always considerations, especially when working with folks from equity to just deserving groups, about like even as simple as do you need a bus ticket to get to the meeting or something like that. I think takeaways, definitely to respect people's, and in particular children and youth's autonomy. They are their own individual beings, and I think ensuring psychological safety and also cultural safety for folks, and being sure to I think just consider making sure we're protecting people from any outing or stigma or harm in research contexts, and to pay attention to the language that we're using. I think language is super important, as I said before, always evolving, but important to think about the words we say and how we can be affirming to people, and non-stigmatizing, and also listen to what the people we're working with have to say about the words that we use.
Awesome. Thank you. And Logan, do you have any final thoughts?
Yeah, one last thing I will say is that for ethical considerations, I don't think it's come up yet, but um just applying all the things that we talked about in terms of flexibility and personalizing that research relationship to specifically to compensation um in terms of um making sure that you're recognizing and compensating folks in the way that works for them, that doesn't create barriers, but also incentivizes them to continue doing this work, and whether that be actual monetary compensation or otherwise, it's important to think about all the different ways that someone can be recognized for their work.
Brilliant. Well, very well said, all of you. Thank you so much for taking the time to be with us today, to sharing your expertise, your knowledge, the practical pieces as well that you've applied to your own projects, your tools, your resources that you've used, and really thinking about even sharing your own learnings journeys as researchers, implementers, the various roles and hats that you have and wear. So very much appreciate your time, and thank you to our attendees for joining today. And this recording will be available on the implementation community website, so people can access after the fact. But yes, just again, thank you so much. That was fantastic. So much to walk away with and apply to our own work. And I think everything that you've shared today is so essential and so critical, and has made me think a lot about the work that we do. And I'm looking forward to being able to apply some of this. So, or all of it, to be honest. So we are right at time, or right over time now. But thank you so much, and we will see you all next time at our next implementation community session in January. All right. Thanks, everyone.